Have you looked at your fingernails lately? Not to admire the polish, not to trim them, but to really look at them. Believe it or not, your nails can sometimes reflect what's happening elsewhere in your body. Changes in color, texture, thickness, or shape. Most nail changes are completely harmless and often happen with normal aging. Others may be linked to nutritional deficiencies, skin conditions, medications, or reduced circulation. And occasionally, persistent nail changes may be one clue among many that it's time to speak with a healthcare professional. Today, we'll explore 6 nail changes that cardiologists and other physicians sometimes pay attention to, what they might mean, and when it's a good idea to seek medical advice. Stay until the end because the final tip is one of the simplest ways to support healthy nails, and it benefits your heart and overall health too. Before we begin, do well to like this video, subscribe to Green Health Channel, and turn on your notification bell so you wouldn't miss any new health-related video updates from us. Let's get started. Why nails can reflect overall health. Your nails are made mostly of keratin, a tough protein. Although they seem simple, healthy nails rely on a steady supply of oxygen, nutrients, and blood flow. That's why healthcare professionals sometimes examine the nails during a physical exam. However, it's important to remember this. Most nail changes are not caused by heart disease. Aging, minor injuries, frequent hand washing, dry weather, vitamin deficiencies, fungal infections, and even genetics can affect how your nails look. That's why nail changes should always be interpreted alongside other symptoms and a complete medical evaluation. Let's begin with the first change. Change number 1, pale nails. Healthy nails usually have a pinkish tone because of blood flowing through the nail bed. Sometimes nails appear unusually pale. There are many possible reasons for this: iron deficiency, vitamin deficiencies, anemia, poor circulation, certain chronic illnesses, or simply getting older. Pale nails alone don't diagnose a heart problem, but if they develop suddenly or are accompanied by fatigue, dizziness, or shortness of breath, it's worth discussing with your healthcare provider. Change number 2, blue or purplish nails. Have you ever noticed a bluish tint to the fingertips after being out in the cold? That can happen because blood vessels temporarily narrow. Usually, the color returns once your hands warm up. However, if blue or purple nail beds persist without an obvious reason, it may indicate that less oxygen is reaching the tissues. This can have many possible causes, including certain heart or lung conditions. Persistent blue nails, especially if paired with breathing difficulties or chest discomfort, should be evaluated promptly. Change number 3, clubbing. One nail change physicians are trained to recognize is called clubbing. With clubbing, the fingertips gradually enlarge and the nails become more curved than usual. This change often develops slowly over months or years. Clubbing can be associated with a variety of medical conditions, including certain lung diseases, digestive disorders, and less commonly, some heart conditions. Many people with clubbing do not have heart disease, but because it can signal an underlying health issue, it's a good reason to schedule a medical evaluation if you notice this type of change. Change number 4, dark lines or discoloration. A small dark streak beneath a nail may simply result from bumping your finger. However, if a dark line appears without injury, changes over time, or affects only one nail, it deserves professional evaluation. In some cases, it may be related to medications, harmless pigmentation, or other conditions that are unrelated to the heart. Because there are many possibilities, persistent changes should always be checked rather than ignored. Change number 5, brittle or splitting nails. Brittle nails are incredibly common after 60. Dry air, frequent exposure to water, cleaning products, normal aging, and nutritional factors can all contribute. While brittle nails aren't typically a sign of heart disease, they can sometimes reflect deficiencies in nutrients such as iron or biotin or other health conditions. Protecting your hands with gloves during household chores and moisturizing regularly may help reduce dryness. Horizontal ridges. Horizontal grooves across the nails are sometimes called Bow's lines. They can develop after a significant illness, surgery, severe stress, or other events that temporarily interrupt nail growth. These lines are not specific to heart disease. Instead, they remind us that our nails often reflect what the body has experienced over time. If several nails develop deep horizontal grooves without an obvious explanation, it's worth mentioning during your next medical visit. What cardiologists really look for. Here's something many people don't realize. Cardiologists rarely rely on one physical sign. Instead, they consider the whole picture: blood pressure, cholesterol, blood sugar, family history, smoking history, exercise habits, symptoms, laboratory tests, and imaging when appropriate. Nails are just one small piece of that larger puzzle. Heart-healthy habits that benefit your whole body. Fortunately, many of the habits that support your heart also support healthy circulation and, indirectly, healthy nails. Aim for a colorful diet rich in vegetables and fruit. Choose lean protein sources like fish, beans, eggs, or Greek yogurt. Include healthy fats from olive oil, nuts, seeds, and fatty fish. Stay physically active with walking, strength exercises, or other activities approved by your healthcare provider. Avoid smoking if you smoke. Manage stress, get enough sleep, and attend routine health checkups. These everyday habits support overall health, not just one part of the body. Don't ignore other symptoms. Nail changes become more important when they're accompanied by other symptoms. For example, persistent chest discomfort, shortness of breath during routine activities, swelling in the feet or ankles, dizziness, unexplained fatigue, or rapid or irregular heartbeat. These symptoms don't always indicate heart disease, but they do deserve prompt medical attention. A simple daily routine. Breakfast, oatmeal with berries and walnuts. Lunch, grilled salmon, leafy greens, and brown rice. Snack, apple slices with almonds. Dinner, bean and vegetable soup with whole grain bread. Take a walk after dinner if your healthcare provider says it's appropriate. Stay hydrated, moisturize your hands, and give your nails a quick look every few weeks. Knowing what's normal for you makes it easier to notice meaningful changes. Common mistakes. Many people unintentionally make these mistakes: ignoring nail changes that persist for months, assuming every nail change is a sign of serious illness, skipping routine health screenings, smoking, living a sedentary lifestyle, relying on internet photos to diagnose themselves. In doubt, a healthcare professional is the best source of guidance. Key takeaway. Your nails can sometimes offer clues about your overall health, but they cannot diagnose heart disease on their own. Persistent changes such as clubbing, unexplained blue discoloration, or nail changes accompanied by other concerning symptoms deserve medical evaluation. For most people, the best way to support healthy nails is the same way you support a healthy heart. Eat a balanced diet, stay active, get enough sleep, avoid smoking, and keep up with routine medical care. Healthy aging isn't about worrying over every change you notice. It's about paying attention, learning what's normal for your body, and knowing when something deserves a closer look. Your nails are just one small window into your health, but they're only one part of a much bigger picture. Take care of your heart, take care of your whole body, and those everyday habits will often benefit your nails as well. If you found today's video helpful, please give it a thumbs up and subscribe to Green Health for more practical, science-informed tips on healthy aging, nutrition, and wellness. Now we'd love to hear from you. Have you ever noticed changes in your nails that made you curious or prompted you to ask a doctor about them? Share your experience in the comments. Your story may encourage someone else to pay attention to their health and seek appropriate medical advice when needed. Thank you for watching, stay well, and we'll see you in the next video.